Hi, it's Paul. This is another sputum specimen, and this one is on an 81-year-old male who had a known left lower lobe mass. Have a look at it. What do you think? Well, the specimen had a lot of mucin and debris and squamous epithelial cells, so it was a sputum. There were scattered pulmonary macrophages, and then the cells of interest were in cohesive balls, and they showed some nuclear variation. Some groups looked three-dimensional. You could certainly focus up and down through them, and some of them looked papillaroid. But that, I mean, they didn't really have a fibrovascular core. They seemed to show peripheral palisading of cells in the group. The cells had fairly abundant foamy or vacuolated cytoplasm, and the nuclei were eccentrically placed and round, usually with some moderate size variation in the groups. Nuclei were mostly hyperchromatic, but showed fairly fine chromatin where they were well preserved and prominent nucleoli. So this was considered suspicious for adenocarcinoma. So the major differential diagnoses here then are reactive bronchial epithelial cells or reactive pneumocytes, such as those seen in florid type 2 pneumocyte hyperplasia. Similar to adenocarcinoma, these can show balls of cells with vacuolated cytoplasm. Chromatin can be coarse and the nuclei can be quite enlarged. These are probably more commonly seen in BALs than in sputum, and the clinical setting can be helpful in that they're usually seen in patients with a diffuse disease and in acute settings, pneumonia or pulmonary embolism with infarction or interstitial disease, so in diffuse lung diseases. And so caution really needs to be applied in patients who especially have diffuse disease and in acute settings. Some authors recommend sequential specimens as a method of getting around this, as the hyperplastic pneumocytes will disappear from samples usually after 4 to 6 weeks. The patient went on to have a left lower lobe core biopsy, and this confirmed an adenocarcinoma with papillary architecture. Immunohistochem was performed because of the papillary nature of the lesion to rule out a metastasis, and then mutational testing was undertaken as well. So thanks for watching.